When we talk about PSE change, we are talking about policy, systems, and environmental change. And there are three parts to that. Policy change, which refers to either laws or rules or regulations. Systems change, that refers to procedures or how things are done. And environmental change, that refers to generally your surroundings. All these terms have use kind of in daily life, but in public health, we tend to think of PSE changes as, either procedures or policies or trying to set up an environment that make it easy for people to make healthy behavior choices.
Policy system environmental changes for us are anything that involves working with local organizations, local government, or local tribal leaders to invoke change within the community, and in our case to better the community's health.
I was pretty new to PSE Change too when I came to ANTHC, and the way I started thinking about it that really helped me clarify the approach is I would think about the saying that if you give a man a fish, you feed him for a day. If you teach him to fish, you feed him for a lifetime. And that's the education approach that had been really popular before. But the problem is, what if that person doesn't have access to somewhere where they can fish? What if there's no public transportation? What if a fishing license is prohibitively expensive? So it's thinking about all the things past education that can really help make those healthy choices easier choices.
One important thing to think about when you're working on policy or systems change is that you are trying to work at an organizational or a community-wide level instead of working with people one-on-one.
Policy in public health is anything like written down regulation that helps people make healthier choices. And that could be, at the state, the federal, the local level. It could be within an organization. For example, at South Center Foundation, they have an hour a week of exercise or wellness time for their employees, and that's documented in HR.
Policy change generally refers to laws or procedures or regulations, and you can have organizational policies as well, so guidelines that your organization sets up. Things like an organizational healthy food policy is an example that would make it, an organizational practice to offer healthy foods at any kind of place within your organization where foods are served or sold.
I would say within tobacco, system changes involved, again, reducing barriers. And we had quite a few things that were going on within our tobacco referral system when I was there. And I really just like to focus on reducing barriers. For people who are ready to quit, they should be able to get an appointment right away. They shouldn't have to go through too much turmoil, having to go see their provider and getting a referral. We should be able to ask for that for them, which was one, systems change that we implemented that has stuck for self-referrals. We also implemented a individual standing order working with pharmacy, where it really reduced barriers for those individuals that wanted to quit because, again, they didn't have to go back to their provider to get their prescription. Their provider, when they sent the referral, noted every single cessation aid that they were eligible for so that we can actually just prescribe it for them. That was a couple of big things. I think the state of Alaska and their promotion of the quit line is one systems, change that has encouraged quite a few people to quit smoking or quit using tobacco.
Policies and systems are only as good as the strength of the agreement that has been made to do things that way. And one example of that is the smoke-free air policy here at ANTHC that went into place many years ago. Since then, there was an enforcement component to that was put into place. Security was involved. And since then, a work group has met regularly to continue monitoring how it's going. Are people conforming to the policy? Do changes need to be made? Are there unexpected things happening, say cigarette butts on the ground? And, is there a way to, correct that problem? And so having the ongoing monitoring of a policy by multiple entities and partnerships can really help sustain it.
You'll hear it a lot that we're trying to make the healthy choice the easy choice. So it's those changes in the environment that allow that to be an easier choice.
I think people hear environmental change and they tend to think about maybe the air or the water or nature. And for the kind of work that we do, we think about environmental changes as including environments that people create as well. And so that can be your food environment in terms of what's available to you, what's on the shelves at your grocery store, what is served at events that your workplace might sponsor. If you think about physical activity, putting in a bike rack is an example of an environmental change that someone can make that isn't maybe as sweeping as what people might think about when they hear the word environmental change.
So for healthy choices, it all comes back to the 4 Ps: product, placement, pricing, and promotion. So the first step with product is just having healthy choices available, and if there's already some, can you get more? Placement is making sure they're easy to find. Are they at eye level? Are they at the register? Are they at those decision points where people can easily find them? Pricing is just making sure that the healthy ones aren't the most expensive. Can you either offer discounts on them, or can you possibly even raise the price of the less healthy options? And then promotion is just, can you have signage letting people know about these options? Can you have labeling, stickers, anything like that?
Yeah, well, I think we really do want to see our communities grow and thrive. And when you're looking at just the definition of PSEs, you're not really seeing like the true impact. At South Central Foundation, we had the opportunity to completely flip, the Coho Cup, which was the little coffee shop there in the primary care center. And when you look at something like that, if you're just talking about environmental change, people are like, oh, that's boring. But when you actually see people get excited because there's traditional foods there, we had pirag, which was my mom's recipe, and they would have it once a week and they would sell out. And that was so cool to see. Also, a lot of times we think about how, if we're getting partners in the community that are, actually for-profit partners, like that one, or like maybe vendors at, a produce stand or something or other, that they're not benefiting, but usually everyone really, really benefits in that partnership because people do want healthy options. And in that situation with this coffee shop, the coffee shop actually saw their profits almost double the year after they made all those changes. And even though it might be more work than selling bags of candy or sodas, there's so much to be said about that, and it's really exciting. As well as, what's not applicable to Alaska, you see these casinos that go smoke-free, and there's been data showing that people actually will spend more time there and actually spend more money there. So just trying to promote it with those stories of successes is very important.
So one of the points in our healthy food and beverage policy is that we want to increase the access to potable water for people. We just want to make it easier for people to drink water. So one environmental change that we've been able to enact here is installation of additional bottle filling stations at the Alaska Native Medical Center. So there's just more places people can go to get that water.
There are two local communities that I really love to highlight when I talk about our program. One being Galvin, Alaska. They were already doing really wonderful things out there. The store owner out there has a beautiful store and is really passionate about, bringing healthy products to the community. So we did work with that local store owner, and we've been sort of tracking our stores and seeing, looking at their inventory of what they're ordering, and comparing it to what they're ordering now after conversations with us. And we have seen an increase in the percentage of healthy foods that are being offered. And some of that just comes from their store leadership. I don't know that we can take all the credit, but I think they feel good that there's allies out there in health that are, having the conversations with them about what they're doing is important. So it's been really good to see that. And then Shishmaref, Alaska, has been really wonderful. Despite really high turnover with their management of their store, every time we walk in their native store, we see marked improvement in how they're even selling their products. They're doing a really good job of ordering enough for the community after conversations of, okay, well, you're posting on the internet that you have one case of lettuce available. By the time the elder makes it to the store, all the lettuce is gone. And so just having those thoughtful conversations with them, their community really does crave, healthful foods. There's a lot of great cooks in their community. And so we have seen that they've made some really great improvements just walking in and being able to see the fresh produce, versus the first time I walked in, it was on the floor in the back. So we have seen some of these, qualitative changes, these anecdotal stories, sometimes don't translate to beautiful data, but it's been really rewarding to see it in the communities, and we know that it's making a difference.
Even though it can feel a little bit challenging at first, it can also be very rewarding when you kind of get to an endpoint and you have done all of the work that you need to do in order to get a policy passed or to get a new system in place, or to make some changes to your environment. And so even though it might feel a little bit overwhelming at first, you can break it down into smaller steps. It's pretty rewarding once those changes get made.